So if you're pushing but nothing's happening, or it feels incomplete, you may be having what is referred to as dyssynergia. Dyssynergia is when the muscle has to relax and it contracts, or it needs to contract and it relaxes. This is as a result of dysfunctional patterns of movement that are existing. Your body parts are not given up on you. They're just handling things beyond what they were created to do. Each part has its primary task, and when the primary task is basically not being handled, someone else, something else has to pick up that tab. Over time, this becomes problematic, and dyssynergia is as a result of chronic condition. So you want to not strain to relieve yourself. This is when you go to the bathroom and you're having bowel movements and it's just not happening. It's just not relaxing. You do not want to strain any muscles, and that's so important. With dyssynergia, there's a strain with no relief. There is constipation or incomplete emptying, and there's also pelvic pain or tailbone soreness that exists. Dyssynergia is coordination. What's important in treatment of it is coordination of movement. It's not a strength issue. It's the coordination that is missing. It is you holding your breath and breathing out of sync with movement that has led to this issue. I'm going to explain this more in detail, and it's essentially a nervous system dysregulation from chronic tension. We innately coordinate our breathing in with movements and breathing out with certain movements. When there is a lack of coordination, we go out of sync in that. A lot of times we just hold our breaths, and that creates tension. That tension over time creates further dysfunction in a lot of body parts. In cases of bowel movement, it's happening to the muscles inside of your pelvis that have to relax in order for you to go to the bathroom, have a bowel movement, and they need to contract once you're done. Sometimes they relax, but they contract prematurely. So all of those are signs of dysfunctional patterns of movement. So the question is, how do we fix that? Well, first of all, from my perspective and in my practice, I work with biomechanics. I'm all about pelvic stability, because when pelvic stability is lacking, you have all the reasons to have dysfunction in your movement patterns. So the first step is to evaluate the environment that you're working at. For example, you're working out. Some of the habits and lifestyle that you may have. This can be things from masturbation and sexual intercourse to how you exercise and how reasonable you are with your exercise plans. Now we need to look at functional mobility. Does this individual have neutral spine? Does this individual have a balanced pelvis? Most often, people have tilted down or tilted up, anterior pelvis or posterior pelvis. This becomes a problem because that becomes the reason why the muscles inside of your pelvis have to behave differently. The lack of instability on the outside, or lack of stability on the outside, means the inside has to work harder to maintain how unstable this becomes, to try to maintain some degree of stability there. So when you have that pre-existing condition, then these muscles are behaving according to what's needed. But when that instability continues on, well, now anything that resides here is going to be impacted. That could be muscles, it could be joints, ligaments, nerves, arteries, blood vessels, your pelvic organs, your intestine, bladder, your prostate, uterus, and ovaries. When this area becomes tight and small, then it's like having 10 people from a big house all put into one room. Well, someone's going to speak up. So dyssynergia is something that is fixable, but not with a medication, not with relaxation through internal work, not with some clam exercise, but with a lot of proper work put in. It's evaluating your workplace, evaluating your exercise routine and activity routine, evaluate your lifestyle and habits, then evaluate you for functional mobility and fixing those. By the time you have synergia, you have ignored this problem for quite a while. So it's time to tackle this. Biological breathing is the first step in the right direction. Biological breathing is something that I came up with, and that's after seeing how people do belly breathing wrong, 360 breathing wrong, diaphragmatic breathing wrong. Biological breathing is what we learn by studying human babies and how that's done. I'm going to make sure we put a video that I did on biological breathing at the end of this video. But make sure you subscribe to the channel and follow me on my social media so you get exposed to these things sooner than later. In case of dyssynergia, I also recommend squatty potty, because that allows increase in inner abdominal pressure, that allows the individual to have an easier time. And finally, that relaxation feeling, understanding how to have it is so important. A lot of times I tell my patients, pretend you're farting during, before, and after going to the bathroom. When you do that, you relax that perineum, and that is very important. Don't get all wrapped up like, oh my gosh, I'm gonna have to go to the bathroom, it's gonna be a mess. Don't have a preconceived notion that that's gonna happen. That does not help. That nervous system regulation as a result of chronic tension does play a role. Biological breathing helps with that as well. Make sure that you subscribe to the channel. Make sure you ask your questions and any suggestions for any videos. And if you need any help, make sure you contact me. Until next time, take care.